The author has no financial interest in the subject matter of this film. A 67-year-old male patient was referred to the clinic, presenting with glaucoma adherent. Accordingly, PKP was planned. A clear graft was prepared of donor's age 42 years old and intrathecal count of 2,688 cells per millimeter square. Regular docking was performed using an artificial anterior chamber, followed by marking the patient's cornea. Hence, it's the only landmark that helps us centralize the cut after the applanation. So we proceeded with the cut. At the end, we noticed that the side cut was on the edge of the applanated zone. When we tried to remove the cut graft, we discovered that only 1/5 of the cornea was cut successfully, and the remaining circumference was left intact. So we cried for help. What should we do now? The graft is now destroyed, and no replacement for the graft. The patient is already on table, and most importantly, what are we supposed to tell the patient? So the idea of suturing the graft back into place flashed into mind. So we sutured the graft into place. 1 suture, 2 sutures, 3 sutures, 4 sutures, up to 5 sutures. Finally, we had a well-formed anterior chamber. Then redocking was performed using the same cone. We made sure this time to find a wider applanated zone. Then we fired the laser with the same parameters. Sutures broke at the end of the laser treatment. When we had to remove the graft again, we thought it did not cut well. But when we held close to the previously cut edge, the peeling of the graft was much easier, and the remaining of the surgery went uneventful. Two weeks post-operatively, the graft was clear. A few days later, a colleague faced the same situation of a small dehiscence zone, but not as extensive. Accordingly, resuturing the graft and then redocking was advised. There was a small corneal tag when the recut was done, but it was not of any significance operatively or post-operatively. As a take-home message, whenever you face a difficult situation, take your time. Breathe. relax, and invent. Because the sky is the limit.